My name is Dr. Ben Sessa. I'm a consultant child and adolescent psychiatrist. I have been working clinically as a doctor since 1997 in traditional psychiatric service with children, young people and adults. I'm also an addiction psychiatrist. We're working with adults with a range of different forms of substance misuse problems. And for the last 15 years, I've been involved in the academic field of psychedelic research, having worked as a senior research fellow alongside Professor David Nutt at Bristol University, Cardiff University and Imperial College London. During that time, I've carried out projects with LSD and psilocybin and DMT and ketamine and MDMA. But my heart is very much in clinical medicine and delivering treatments to patients, not exploring academia. What has happened in recent years is I've had the opportunity to open a new clinical service, and we have a company called Awakn Life Sciences, and we are on the verge of opening our first physical building here in Bristol, delivering psychedelic-assisted psychotherapy, initially with ketamine and then with MDMA and psilocybin as these compounds become available. We will also be providing training for therapists to become psychedelic therapists, as many thousands of such therapists will be required in coming years as these drugs become approved. And we are opening a small independent clinical research unit. What drives me is that traditional models of psychiatry are failing our patients. Most long-term chronic mental health problems are driven by rigid narratives formed very early in life, usually as a result of child maltreatment and adverse childhood experiences. And the result is the patient forms very difficult to shift narratives about themselves and the world. And this is what makes most mental illnesses chronic and unremitting. These people are a tremendous burden upon the mental health service in terms of financially, not to mention their own personal distress. And our current treatment modalities are poor and failing them. What we tend to do is use a top-down biological psychiatry model to provide daily maintenance therapies with drugs such as SSRIs, which do not get to the root cause of the problem, which is usually trauma. We just paper over the cracks and treat the symptoms, and therefore patients remain in services for their whole lives. This is both ethically and morally wrong, but also financially a very poor model of doing mental health. Now, what the psychedelic medicines offer are the most innovative and far-reaching attempts to change the entire paradigm of how we do psychiatry. The psychedelic experience allows the patient to address and explore and resolve these difficult to shift narratives for the first time in their life. I'm a registered MDMA and approved psilocybin therapist, and I've seen these treatments work firsthand. There's also a plethora of data from multiple studies around the world demonstrating the safety and efficacy of these treatments. Nevertheless, we are several years away from getting full approval from MHRA, FDA and EMA for these drugs to be used in clinical medicine. I'm very keen on finding a way forward to get past this bottleneck. In the next few years, whilst we're waiting for full approval for psilocybin, we're going to see increasing numbers of deaths and misery and distress and financial burden of chronic unremitting mental disorders that we are quite convinced would respond extremely well and quickly to psychedelic therapies with psilocybin. I would like to work with authorities to find a creative mechanism to start using psilocybin ahead of approval. This has been done in other countries in which psilocybin has been used for compassionate use on a named patient basis for patients who are willing to go through a treatment protocol with an unlicensed medicine. And I am quite convinced there are many such patients who are willing to do this. Such an approach is not novel. It happens quite frequently, particularly with oncology drugs. When a drug is in the final stages, late phase 2 or early phase 3 stages of development, and it's being shown to be safe and efficacious, there's often a kind of patient power lobby from the patients saying, we don't want to have to wait for another 3 years for full approval. We would like to start using this medicine right away under strict, scrutinized, carefully monitored medical protocols. What we would like the government to be considering is, can we come up with a similar such scheme for psilocybin? It's still many years away of collecting the full data, but to wait that long, we will see thousands of deaths and thousands of more cases of distress and chronic mental disorders taking hold that we believe we can start to tackle right away. In the context of COVID, we undoubtedly have the worst to come when it comes to the social, economic, and psychological manifestations of this pandemic. So now really is the time to start thinking innovatively about opportunities to tackle this problem, rather than waiting for the problem to get worse. We have a physical platform in our clinic in Bristol to start doing this. We will be beginning our work with ketamine-assisted psychotherapy, because that's the only approved psychedelic drug on the market to date. But it is not, in my personal opinion, my preferred compound. I'm much more keen on pushing forward MDMA psilocybin-assisted therapies. So if we can work with government groups to find a mechanism to provide psilocybin-assisted psychotherapy out of our service in Bristol as soon as possible, it will really push this field forward. We would also be able to provide safety data on an ongoing basis, which will assist towards the approval process in the coming years. But for me, the most important thing is actually getting these patients through the door and getting them treated with safe and efficacious protocols that we know are going to improve the quality of their lives. There's no question that in the minds of the general public, and indeed the medical profession in many cases, these drugs such as psilocybin are maligned and disapproved of. In my opinion, this is a sad and erroneous manifestation of many years of their being banned for recreational use. And I think it's very important when we look at these compounds medically that we are completely dissociated from the way these drugs are used recreationally. It's comparing oranges and apples to compare the clinical uses of these compounds with how they may have been taken in non-medical recreational settings. We have enormous safeguards around safety and patient management that make these drugs incredibly safe, and ironically, considerably safer than drugs I prescribe on a daily basis to my patients for other psychiatric conditions. So we really need to work hard to tackle this stigma. This is not about increasing access to dangerous drugs. This is about providing safer and efficacious medicines to patients who deserve these treatment protocols and will benefit. To delay pushing forward this at this stage will not only leave more patients in limbo untreated, but it will also further persist and maintain the stigma that is hampering research. It's always been my mission to work with authorities, not against authorities. There's a great deal of unhelpful dogma that comes from the recreational drug using community, or indeed the psychedelic community itself. Finding the correct language to communicate with politicians and the general public and GPs and patients is really the main thrust of my last 15 years of work. I strongly believe that this is a new paradigm for psychiatry, and we deserve the opportunity to deliver this in a platform that's safe and will benefit these worthy patients. So we are in this position at the moment where we are waiting for full approval for psilocybin on the basis of phase 3 studies, and this could be many years away. It is, however, not unusual that drugs in late stages of development, where safety and efficacy has been demonstrated, but they're still not fully approved, can be pushed forward for compassionate use on a named patient basis for patients who are willing to give their consent for the medicine to be used off license in that way. We've seen this in Canada with, I think, 4 cases to date who have signed up for psilocybin-assisted psychotherapy pre-approval. This is a really important, bold, creative, and innovative move. And it's not unusual that this happens with other drugs. we've seen this many times before, particularly with oncology drugs, where drugs in the late stage of phase 3 development, pre-approval, are allowed on individual case-by-case basis to be used in patients who are willing to consent. I believe this would be a great model for us to do in the UK. The use of psilocybin within research protocols is indeed possible, and the Home Office made that clear in their recent statement. But research studies are very cumbersome, difficult, and incredibly expensive to run with Schedule 1 drugs. So if we can find a creative way to use these drugs pre-approval under the strict scrutiny of well-designed and safe and monitored protocols, as they're doing in Canada, this would be of enormous benefit for patients. It would also push forward the whole field of psychedelic research and expedite the actual approval of these medicines for use in wider circumstances. Psychedelic medicines have enormous potential across the whole field of psychiatry. Indeed, in my opinion, any condition within psychiatry that's responsive to psychotherapy could potentially be responsive to psychedelic-assisted psychotherapy, from eating disorders to personality disorders to depression, indeed even to aspects of psychosis one day. To date, most of the work with psilocybin has been focused on treatment-resistant depression or on addictions. These are two fields that have enormous clinical burdens, financial burdens, personal burdens in the UK society. And they're also, very sadly, conditions that the current treatments are poor in terms of outcomes, with high levels of treatment resistance and huge numbers of patients remaining in services for decades unnecessarily. So I can see the expansion of psilocybin-assisted psychotherapy to further conditions beyond just treatment-resistant depression. But to date, most of the data has been done on treatment-resistant depression and addictions. Through increasing access to these medicines for patients, we have the opportunity to expand our knowledge and understanding and come up with new protocols that could be used more broadly across the field of psychiatry.